Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. So in this video, we're going to go through the Reminiscence Therapy, which is part of the Mental Health OSCE exam. So for this station, you have 8 minutes. The common scenario for this one you have is a community patient in a care home. And as I always say to you, best thing to do before the exam and to study now is the marking criteria. So we're going to run through that in a minute. Basically, for this station, you will have an actor who is playing the patient, and you will have like a box or a bag of items which you need to go through and discuss with them. And that's it. It should be quite an easy, straightforward station to pass. The first thing you need to do for this station, as with many of the other stations, is introduce yourself and ID the patient. So quite straightforward. Hello, my name's Beth. I'm the nurse looking after you today. And then to ID the patient, you're going to, considering it's a community scenario, ask the name, date of birth and the address and check it against your paperwork. If you have the hospital, you're going to also check the wristband. Then you're going to explain the intervention to the patient. So we're going to do your reminiscence therapy today. Is that okay with you? And it says to kind of establish rapport, so you can ask, how are you doing? Just have a general chat with them and try and help them relax a little bit. So obviously you need to be using good eye contact, which is in the marking criteria, and body language. So open posture, not like crossed arms or anything, and be smiling with your patient. So you will have a little bag or box containing different items to show them as part of the reminiscence therapy. So these are photographs, you'll have a vanilla essence, which is the one you use to make cakes, toy animals, and the last one is marbles. Okay, and then you need to go through all of these and kind of discuss with the different senses. So obviously you've got sight, sound, taste, touch, and you need to go through all of these things. So smell as well, I almost forgot. So just go through each item. You don't have to use them all, but use a few of them if you want. If you want to use them all, that's fine. And say different things about the senses. So sight can be looking at the photo. So what's this photo of? What does that remind you of? Oh, it's your family. Have a little chat about the family. Smell, you could use the vanilla essence. What does the smell remind you of? Allow the patient time to talk and ask appropriate questions. If they do talk about some things they find upsetting and they become distressed, try and steer the conversation away. So it also says demonstrates the ability to show empathy. So they might talk about some sad news, for example, a family member dying, something like that. So just respond appropriately. And that's it for that one. Remember to review your marking criteria. Okay, so before the end of your session, I would say use it about 6 minutes before you finish, so make sure you have plenty of time to cover everything, and then you've still got 2 minutes to wrap up. It says to recap the discussion with the patient. So, we talked about this time you had with your family, how you enjoyed making the cakes, that kind of thing, and then end the session appropriately. Thank the patient for cooperating with you, and that's it.